Joint replacement surgery is a well-established treatment for those patients who have hip and knee arthritis. Going through the procedure, though, can be a daunting prospect for anyone. In this video, we hope to guide you through that process. If you're a suitable candidate for joint replacement, your surgeon will list you for that procedure. While you're waiting, it's important to plan ahead and prepare your body and mind for major surgery. You should think about your aftercare and what help you will need from family or carers when you go home. Everyone can improve their fitness prior to surgery, and it's important to stay mobile, eat healthy and stop smoking. This will give you the best chance to go through your surgery as smoothly as possible and to recover quicker. Up to 12 weeks before your surgery, you will visit the pre-op assessment unit. Here the nurses will do a number of tests. They'll check your blood pressure, take bloods and perform ECG. They'll prepare you for the process of surgery. You may meet physios, occupational therapists, or even an anaesthetist if you're considered at high risk. On the day of admission to hospital, you'll make your way to the elective orthopaedic unit. This is in level 5 and you can find it via the main lifts. During your stay, you'll meet the entire team, which includes social worker, physiotherapist, occupational therapist, pharmacist, nurses, surgical and anaesthetic doctors. The unit promotes a PJ-free policy and you should bring in your normal clothing for your stay. On the day of surgery, a porter will collect you from the ward and take you to the theatre complex. You will arrive at the anaesthetic room first, which is next door to where you'll have your surgery. The anaesthetic team will look after you at this stage, and most patients elect to have a spinal anaesthetic where you are partially awake. Once you've had your anaesthetic, the surgeons will position you on the table. This is to ensure you're as comfortable as possible throughout the procedure. The surgeons will prep your leg with antiseptic, they will drape your leg, and the team will get you as relaxed as possible as you go through your surgery. After the procedure, you'll be taken to the recovery ward. Here, the recovery team will ensure your obs are stable prior to going back to the main ward. On the day of surgery, when you've been back on the ward for a period of time and you're deemed medically stable, you'll be assisted out of bed. Early walking practice may also start at this stage, which could mean just a few steps. On day 1, the occupational therapists and physiotherapists will progress your rehabilitation, particularly walking and transferring in and out of bed and on and off chair and toilet. Early participation in this significantly reduces the risk of complication and aids speedy recovery as part of our new enhanced recovery programme. By day 2, you should be starting to progress well. You will learn how to safely use crutches or a walking aid. The therapist will supervise these skills and ensure that you're competent on both the flat and the stairs. When you're deemed safe, you'll be ready for discharge. This is usually 2 to 3 days post-surgery. During your stay, the therapist will show you many exercises which you can also perform at home. By day 3, you should now be ready for discharge. The ward doctor will give you a letter for your GP, and you'll be provided with any necessary medication by the pharmacist and, if required, any equipment by the occupational therapist. It is important to remember to take home your mobility aid. Please ensure that you have someone available to collect you from 11 a.m. on the day of discharge. When you're at home, a district nurse will visit you for wound check, dressing change and bloods. Clips of views will be taken on day 10 to 12 for total hip replacement and day 12 to 14 for total knee replacement. It is important to continue with any medication to prevent blood clots until the recommended time. It is normal to have pain and swelling around your wound. This swelling may take several months to disappear. You should, however, contact the helpline if the pain increases or becomes severe, the wound or lower leg becomes red, swollen or hard to touch, you notice fluid or discharge from the wound, or you feel unwell or develop fever. These symptoms could be a sign of infection. Whilst infection is rare, it is important to deal with it as soon as possible. Your surgeon would need to see you to assess the wound and may commence you on either oral antibiotics or indeed IV antibiotics, depending on severity. You will receive a review appointment after your surgery. You'll meet one of the orthopaedic team to check your wound and x-ray. We may ask you to fill out forms so we can collect data to improve our service, and you'll also be offered long-term follow-up, either by a specialist nurse or one of the surgical team. Try to stick to a normal routine. Get up and get dressed in the morning. Keep mobile and continue with regular exercises prescribed by your physiotherapist. This will reduce joint stiffness and help you with movement in your new joint. Most people are able to walk without frame or crutches after 6 weeks. If you've had a hip replacement, you must continue with your precautions for the 12 weeks. Discuss with your surgeon about driving. You need good knee movement to be able to control the car and carry out an emergency stop. Depending on your job, you may be able to return to work between 6 and 12 weeks post-op. Continue to maintain a healthy lifestyle with a good diet and avoid smoking.